Good afternoon, everybody. Thanks for joining us. Today, as announced, we're going to talk very briefly about childcare access and LA's COVID recovery. But first, we would like to acknowledge the Gabrielino Tongva peoples as the traditional land caretakers of Tovangar. So the session is motivated by a recent Lewis Center report entitled, as you can see on the screen, Access to Childcare in Los Angeles County, Recent Trends and COVID-19 Implications, written by myself and two of my colleagues. You can see their names on the screen as well. Sammy Busal, who's a graduate student research assistant at the Lewis Center, and Madeline Brosen, who's deputy director. You can also see at the bottom, we have the URL. So if you haven't, of the report, so if you haven't yet looked at it, this is where you can find it. So with this and our 30-minute time slot in mind, we're going to do three things this afternoon. So I'm going to sort of kick things off by giving a very brief overview of the report and the motivations behind it. Then I'm going to turn things over to Jamie Kalenik from First 5 LA, and she's going to give a policy response, and then we're going to open things up to you all as well for comments and questions. So why the focus on childcare? For those of you who don't know, the Lewis Center is a center that is located in the UCLA Luskin School of Public Affairs. The center studies and addresses pressing policy and planning issues that affect the sort of larger LA region. And so specifically, we've been focusing on issues related to affordable housing, jobs in the regional economy, and transportation. So how is it that families can access opportunities in the region? So with respect to this last topic, it is clearly difficult for families who have children to engage in any opportunities outside of the home without ensuring that the children are safely cared for. Much of this burden, as we know, for caring for children falls on the shoulder of women. And then finally, as we talk about in the report, the COVID crisis has only exacerbated these trends and difficulties. So we've heard often in the news and in other research reports that many women have had to drop out of the labor force because they couldn't find care for their children, with potentially long-term negative economic consequences for themselves as well as their families. So as this slide shows, the LA metro region has more than 500,000 workers living in households with young kids, in this case, kids less than 5. 59% of women with young children are employed, and women, as I mentioned before, tend to be responsible for kids and for household serving work, which includes travel to childcare. And I'm going to come back to this last point toward the end of my comments. Now, childcare decision-making is difficult. Certainly not every family wants or needs to have their children in sort of formal care, even if they do work. Some families choose to have family members and friends take care of their kids. Others clearly choose to send their kids to centers, whether they be larger daycare centers or centers that are located in other people's homes, as well as sort of infant care. There are also many other characteristics that influence the child care decision-making process, and we've put the schematic on the left is in the report, and so we've grouped them into 4 different areas. You can see parental preferences, the characteristics of households, provider characteristics, including, of course, the cost of childcare, and then various policy supports. They may be policy supports on the wage side of things, but certainly childcare subsidies for both families and providers fall in this category as well. This graph, which is in the report, shows the composition of child care centers in LA County by the three major types that I just talked about, sort of infant centers, daycare centers, and family child care homes. They have remained, even though you do see, some change over time in the total number of centers, the composition has remained much the same over time. About 50% family child care homes, 42% daycare centers, and about 8% sort of infant care. There are sort of major challenges to childcare that others have talked about, and certainly we talk about in the report as well. A big one certainly is high costs. The second is limited supply. And the third is this sort of patchwork of policies and subsidies that we have to support both families and childcare providers. And I'm going to talk just very briefly about all three of these. On the cost side of things, these are numbers from sort of LA County. In the county, families with median household income, so about $54,000 a year, spend between 16 and 26% of their income on childcare. Certainly that childcare burden increases as families have more than one sort of child in need of childcare. The Center for American Progress just came out with a report on childcare costs, and certainly they find that there's a good deal of variation in the costs based on the type of care, the age of children, sort of as well, and the quality of care, which is related to the child care workers and their wages. So they find that, as we might expect, high quality infant and family care is the most expensive. So let me turn just briefly to limited sort of supply. In this graph, we did some back of the envelope calculations to estimate the supply of childcare slots relative to the demand as of, as you can see, December 2020. The first bar shows the number of childcare slots in the county as of that date, so about 220,000. The second bar shows the number of children who are under 6 years of age and are not yet in kindergarten. And then we drew on data from the National Household Education Survey Program, and they find that about 36% of children are in center-based care. And so using these figures, we estimate that the demand for childcare in LA County slightly exceeds the supply. Now, the supply of childcare certainly declined during COVID, where many childcare centers had to shut their doors. So this graph shows the number of childcare centers and slots that were lost from March to December 2020. You can see that the family childcare sort of home providers were hit hardest by this crisis. And the Center for American Progress, again, estimates that on average, the costs of running a center increased substantially during COVID. So on average, about 47%, and much higher sort of increase in costs among family care providers. So costs increased about 70%. Now, there are other sort of access barriers, which is why our back of the envelope calculations really do underestimate the mismatch between supply and demand in the county. So first, with respect to costs, it's important to keep in mind that many families might choose to send their children to childcare if high quality childcare that met their needs was actually available. And then, of course, there are other barriers, which include, sort of the match between available childcare and the age of young children. And certainly a scarcity of infant care is in the mix here. Finding the right language match in terms of childcare sort of providers that speak the language that your family speaks. And then a subject of interest to us is the location of childcare centers as well. Is there a center located in close proximity to your home or perhaps your workplace? And then finally, there has been relatively limited childcare support. So you can see on this slide, so this patchwork of policies and subsidies, perhaps thanks to President Biden, sort of some help on the way. This table is in our report. It shows some of the federal, state, and local programs that are available to help support both families and childcare providers in the county. This slide is not in the report. It comes from a recent report by the Brookings Institution. So in March, President Biden signed into law the American Rescue Plan Act. So on this slide, ARP, which included expanded child care benefits, the child and dependent care tax credit, so on the left in the slide, and then the child tax credit program, which sort of greatly expanded benefits for both sort of families and children. However, the administration is struggling to further extend and make these changes permanent as part of the American Families Plan. So if you listen to NPR this morning, that was the subject of conversation about the political thorniness of this additional sort of extension of benefits as part of enhancing social infrastructure in the US. So let me sort of summarize our sort of findings and recommendations, and then turn to how the Lewis Center is going to build on some of this sort of initial work. So on the findings side of things, we make three sort of general sort of points. So first, that childcare access was in short supply before the COVID-19 pandemic, and that certainly things got worse during this sort of both health and economic crisis. So, so lots of closures during this sort of period. And actually, I would argue that closures underestimate the turbulence that childcare providers faced during this pandemic. And then finally, that the lack of access to childcare will inhibit the economic recovery of the LA region if parents, particularly women, remain challenged in terms of finding high quality, affordable sort of childcare that enables them to continue or to re-enter the labor market. On the recommendation side of things, we recommend sort of three general areas of policies. So first, sort of, clearly expanding financial support for providers and parents, ensuring just compensation and barriers to unionization for early childhood educators or childcare educators. Again, keeping in mind the strong relationship between sort of wages and protections for the childcare workforce and the quality of care. And then finally, I wouldn't be a reasonable academic if I didn't mention the sort of this last bullet point, sort of increase the collection and analysis of childcare data to better understand, and then of course to better address barriers to childcare access. So my last slide for this afternoon focuses on how we intend at the Lewis Center to build on this childcare research. And so first, we are interested in understanding neighborhood variation in the supply of childcare access. So really looking at the LA region, trying to look at that variation, ideally by the characteristics of the supply of childcare as well, relative to where working families both live and for those families who want childcare by their workplace, adjacent to where they work, with a focus on low-income households. And then second, I mentioned early on that the Lewis Center does a tremendous amount of work related to transportation and transportation equity in particular. And so we are very much interested in better understanding sort of travel behavior, transportation patterns for childcare trips, and that linkage between where childcare centers and available childcare slots sort of are, and the likelihood that families find appropriate care for their children. So with that, I am now going to turn things over to Jamie Kalenik from First 5 LA. Jamie is a program officer on early care and education for First 5 LA, and among other things has worked specifically on LA County's early childhood education COVID-19 response team, and we're delighted to have her here with us this afternoon. So let me stop sharing my slides and turn things over to Jamie.
Great, thank you, Evelyn, and thank you to the UCLA Lewis Center for having me here today. Really excited to see these future research projects and how they can support families in their access to early care and education. Just a little bit about First 5 LA. We're an agency focused on improving early childhood systems in Los Angeles County so that all children enter kindergarten ready to succeed in school and life. And before jumping into the policy opportunities, I wanted to start by reiterating some of what we've learned about childcare and early education during the pandemic, and how this crisis really exposed many of the cracks that already existed. First, we saw that the flexibility and adaptability of the system relies on the strengths of a mixed delivery model, which includes home-based care, such as family childcare homes, and family friend and neighbor or license exempt care. While many centers had to close and stay closed because of reduced revenue and increased costs, a much larger percentage of family childcare homes were able to stay open. For example, we saw that in the summer of 2020, over 2/3 of family childcare homes were still open for in-person care, and that was compared to less than 1/3 of early education centers. And a lot of these are temporary closures, but some of these temporary closures will sort of turn permanent. But I do want to be clear that just because these providers were able to stay open to serve families, it does not mean that it was not a struggle. And I like that turbulence word that you used, Evelyn. Surveys of family childcare providers across the state have shown that many did not pay themselves at some point during the crisis, and or took on additional credit card debt to pay for cleaning supplies, personal protective equipment, or to make up for fewer children attending. So even though they did stay open, it was a huge burden. And while the financial model for early care and education was flawed even before, the pandemic really exacerbated the financial strain that many early education and childcare providers face. Even in the best case, what the state pays for subsidized care does not cover the actual cost of providing that care, and that really translates into very low wages for providers. But with limited group sizes to prevent the transmission of the virus and increased supply costs during the pandemic, models showed there are larger funding gaps per child per year across all ages and settings, with an especially large swing in center-based care for preschoolers, which is normally the most economically feasible age to care for, and part of the reason that we saw so many centers struggle. And I also want to call out the issues of equity in childcare that the report highlighted, since the pandemic also brought many of those to the forefront. Black and brown women were the most impacted by lack of access and affordability of childcare in the pandemic, but they're also the majority of the early educators who were impacted by low wages and tough working conditions in the field. But as unspeakably difficult and traumatic as the pandemic has been, it's also presented some opportunities for better supporting childcare access. From national outlets like the New York Times to our local public radio stations, media is really publicizing how essential early education and childcare are, not just as support to help children develop, but also as real drivers of the economy, especially as this report points out women's participation in the workforce. And while this attention has not yet translated to increased wages for early educators or affordable options for all parents, we've seen unprecedented investments from federal, state, and local governments. As mentioned, the latest federal stimulus, the American Rescue Plan, did include additional funding for the Child Care and Development Block Grant, but that expanded child tax credit is now fully refundable and estimated to reduce the number of children living in poverty by almost half, which is huge. And though we don't have all the details yet, the record-breaking state budget also looks to invest heavily in childcare and early education, not least because of the union Child Care Provider United's negotiations with the administration. But one of the biggest opportunities I want to point out is at the local level. As that chart in the report shows, most local funding for childcare has traditionally come in the form of quality improvement programs through Quality Start Los Angeles. But with the CARES Act funding that was distributed to local governments as part of the pandemic response, both the city and county of Los Angeles invested directly in providing childcare through vouchers for parents and grants to childcare providers. And though those investments only met a small percentage of the need, having local governments recognize the importance of early education and childcare is a real opportunity moving forward, especially if they're willing to start using more local dollars to support the system. And aside from just funding, this local momentum has the potential to address some of the infrastructure issues like transportation and zoning and other barriers to opening childcare and early education businesses, and the potential to use workforce development programs to support the childcare and early education workforce, which is traditionally left out because of the low wages in the field. And I want to end my comments by talking a little bit about what the early learning team at First 5 LA is focused on. We look at everything through the lens of policy and systems change because, as the report recommendations suggest, there is no one solution that will create a childcare system that supports optimal development, meets family needs, and justly compensates the early education workforce. Because of what we learned during the pandemic and because of our organizational value of diversity, equity, and inclusion, a big focus of our current work is on supporting the system of home-based care. We know that the majority of children, and especially the vast majority of infants and toddlers, are served through home-based care. These are the providers that are able to meet the needs of working families with irregular hours. Many families also appreciate how home-based providers can meet their specific cultural and linguistic needs. And because they are located in neighborhood homes, these providers may be more accessible and convenient for families. So we're about to launch a landscape analysis to better understand LA's home-based care system, planning to work closely with these providers and parents to understand the strengths and challenges of the system, who and where they are, what networks they're a part of, and how they access support and resources, and what they need both to better support children and to thrive in their businesses. And this analysis will be a launching pad to develop strategies for improving the infrastructure around home-based care, including how to attract new providers to increase the childcare supply in Los Angeles. And as that analysis is conducted, we're working with our partners in Quality Start Los Angeles to make sure that home-based providers are connected to resources that are already available and that those resources are responsive to their needs. But it's very important to acknowledge that all of the quality support resources in the world do not change the fact that early educators, whether in home-based settings or in centers, are severely and unjustly undercompensated for their work. So we also have a lot of strategies that focus on policy and advocacy. We advocate directly with our partners in the State EC Budget Coalition to support increased funding for early learning through both reform of the reimbursement rate, which determines how much providers are paid per child receiving a subsidy, and through increasing the amount of subsidies available and making them easier for families to access. And though slow progress is being made, it will be necessary to have other voices at the table with us, recognizing the economic and social benefits of a wide range of family-friendly policies, so that childcare providers in the private market are also able to make a living without families having to spend a huge percentage of their incomes on childcare. And then finally, we continue to work with local systems leaders as we have throughout the pandemic as part of the LA County Early Childhood Education COVID-19 response team to coordinate resources throughout the county as we transition from response to recovery. So I'll wrap up my comments there and turn it back over to you, Evelyn.
Great, thanks so much. So now we have 5 minutes remaining. What I'd like to do is just open things up either from some questions from participants or or from some of the folks that are organizing this session. So I am looking in the Q&A and I don't see anything. If you do have questions, please put them in the Q&A. Could be a question. It could be a comment that you would like to sort of make as well. All is fair game.
Hi, this is Madeline Brosen, kind of being a bit of a disembodied voice here in the background. Thank you both for your comments. I think that, part of the difficulty in addressing this is there's so big of a need in a lot of different places. And so kind of as maybe a functional question for Jamie, you talked about the Quality Start LA. Can you tell us a little bit about who that organization is and kind of then who are some of the other government players that are really working together to try to address this issue, especially in kind of increasing the supply related to home-based care?
Yeah, so Quality Start Los Angeles is a consortium of organizations that are working to increase the quality of childcare throughout Los Angeles County. That includes First 5 LA and the Los Angeles County Office of Education, which are the main funders. And we get funding from the state First 5, as well as state funding through the state preschool program. But there are many others that are involved in that, including the Child Care Alliance of Los Angeles, which is the membership organization of the resource and referral agencies, Child 360, and Peach, which is a higher ed organization. And I'm sure I'm forgetting some, and so I will hear about that later. But there are other players locally, and one of the most important is at the county, which is the Office of the Advancement of Early Care and Education. They actually sit in the Department of Public Health, which was really helpful during the pandemic because we were really able to see both the effects on childcare that the pandemic was having, as well as having sort of the latest data on how to make sure that we could keep childcare operating safely. So those are some of the kind of main players. But I do have to say a lot of the policy decisions come at the state level. So it is really a larger conversation. But like I said, the huge opportunity is that the city and county, both the Board of Supervisors and the City Council have really taken notice of how important it has been to keep the economy going throughout the crisis, to have childcare available, especially for essential workers, that this is really a great opportunity for them to get involved, especially as we look to sort of rebuild and reimagine what the local system looks like.
Great, thanks, Jamie. So the next question we had is kind of coming very much back to kind of urban planning and policy, and is about some of the land use and zoning barriers to childcare centers.
So I'll take that briefly, and we do have a small section in the report where we look at those issues. So they typically come up related to we were just talking about the home-based care, because those providers are located in residential sort of neighborhoods. So in LA County, as we understand it, small sort of home-based sort of providers are sort of allowed to operate without special sort of zoning and permitting restrictions. However, like other kinds of developments, certainly there have been sort of cases where home-based providers are challenged by neighborhood residents who would prefer not to have a business located in their neighborhood. So there still remain sort of challenges despite the sort of allowance in LA and LA County for home-based providers.
I don't know, Jamie, if you wanted to add anything onto that.
Yeah, I mean, I think there was especially movement at the city to streamline some permitting processes, especially since these are family childcare homes are businesses. So there are a lot of different ways to sort of tackle making it easier to open and operate a family childcare business. But we're also subject to a lot of the other forces that are happening in the county raising rents, high property values, that affects the childcare industry just as much as sort of anybody else, and at an already sort of financially precarious position. So there are some things that we should be looking at, especially when we're thinking of childcare licensing and fees, if there's a way that we can take some of that, those barriers off of childcare providers, since it is sort of working towards a public good that we know we can all use more of. So rather than having independent businesses, childcare businesses having to pay all those fees, having to pay for inspections, there's some different ways that we can think about pooling funding to support that overall.
The one other thing is, I think it's just I'm curious what Jamie thinks about this is an outstanding question is, so there's lots of debates about the use of commercial space right now that a lot of businesses are thinking about more hybrid operations. So for the larger, we were talking about home-based care, what happens in neighborhoods. One, I think, outstanding question is how we could repurpose, and some cities are starting to do this now, think about repurposing some of the commercial space and making it easier to include child care as part of maybe more recently and potentially more affordable commercial space in cities like Los Angeles. And so there's a lot of debates about that happening around the country. I don't know, Jamie, if you have any thoughts about that.
Yeah, I mean, I think we have to attack it from all angles. That as you've shown, that we're underestimating demand most likely, and that the supply isn't even meeting the demand that we're underestimating. So we're going to have to find a lot of sort of different ways of increasing the supply. And we come from the position that as long as it's meeting needs and serving the children, and that we're still sort of supporting that mixed delivery system that takes into account culture and language and parental preference and needs, that there's a lot of great ideas that we can be really creative about in making it more accessible.
So I know we're at the end of our half hour. I do want to say that, one of the challenges that we have found maybe relates to that last bullet point is sort of the lack of access to data. So Jamie just talked about, we are definitely underestimating that gap in supply, in large part because I think, and maybe I'm kind of justifying the sort of the next steps in the work that the Lewis Center is going to be doing, but is really to have a much better idea about variations in the supply by the type of care, but also some of the other dimensions that we talked about this afternoon. So we have much more sort of granular data. So then we can then think about, is it a land use barrier? Is it a cost barrier? Is it a language barrier? Is it an age barrier, finding sort of appropriate age sort of slots for children. And I think we would, moving forward, certainly like much more granular sort of information about that to better target our policies. So with that, I want to thank all of you for attending. You can check out the report on the Lewis Center website, and I think Maddie put the link in the chat. And I want to thank Jamie for her work in general and her thoughtful sort of comments this afternoon. Thanks everybody for joining us.
Thank you.